learn something about your health and I believe your children's health today. So please join me in welcoming Dr. Jamie. Please teach us how to be healthy today.
One of our church members, what should I talk about next week? And so they specifically asked for how to talk about our children, or how to talk to our children about coronavirus. And so there's a lot of fears out there. And so I went online and I looked at the CDC website. I looked at the AAP, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and other professional websites, and kind of compiled everything that they had said into these 9 slides. And then I also, throughout the week, when I saw my own patients, I see kids. And so I would ask them, and I never asked them before, but I would ask every single one of them, just kind of taking my own sample poll, and every single one of them, 100%, said that they were fearful. And so this is something that is relevant. So our very first slide, see if I can work this. You might need to control my slides for me up there. I'll tell you when to advance. Is just a general, anxiety in children. So what would you see if your children were anxious? They might be acting out. They might be misbehaving, hyperactive. They might be aggressive. They may be irritable. They may also be depressed. They might be clingy, like more holding on to you, not wanting to let you go. They could have sleep disturbances, whether too much or too little. Their appetite may be disturbed as well, too much or too little, and they can also have a loss in pleasure seeking, which is anhedonia. One thing I didn't actually put in there, but we actually see a lot in pediatrics, is that when kids get anxious or depressed or fearful, they start having more physical complaints, headaches, stomach aches, etc. Next slide, please. So when they are in this time of trouble, of fear, for lack of better terminology, I call it a tantrum. And so you can actually use the acronym HOST to kind of remind you of what might be causing that tantrum to occur. Are they hungry? Are they overstimulated? Are they too sleepy? Have they gotten enough sleep? Have they gotten enough exercise? I know for my children, once they start acting out, we get them out the door. And then once they're actually in that troubled mind state, it's very difficult to come back out of it. And one psychiatrist actually used the analogy of a snow globe. So you know how you have a snow globe, you shake it up and stuff, and you see all the glitter and all the snow that's kind of floating around there. That's what's happening in your child's brain, or actually in any of our brains when we're under the fear. And so we want to wait and we want to calm down until we can get all that stuff to settle down. And so some things you can do while your child is in that tantrum period is to just calm them. Have them breathe. Model how to breathe in and out, in and out. You can have a time in. And what I mean by that, I've actually had to use this with my youngest child the most, is that when they're anxious and when they're just screaming, you just take them and you give them a big bear hug. It might at first cause them to be more, fighting, but after a while they'll eventually calm down and to be able to hear. And just kind of, you can actually use even a water bottle with glitter in it. And if you shake it up, you can just kind of have the kid just kind of wait until all the glitter settles down. And at that time when they're calm is when you can actually talk to them. How you can actually prevent some of these is actually by setting aside a regular special time of 15 to 20 minutes with each child, doing what they want to do. And that extra time will help prevent some of this acting out. Next slide, please. Some general talk points on how to talk about coronavirus is, number one, you want to find out what they know. Next slide, please. So you want to ask them, what is it that you've heard? What is it that you're scared of? And get from them what they are scared about. And then you can use that opportunity to fill in the knowledge gaps that they have. Any kind of myths or misinterpretations or any kind of non-factual things, you want to be able to address that at that time. You want to be as honest but yet as positive as possible. You always want to point them to the helpers. There's always helpers out there to kind of help us so that we're not in such a fog. You want to make sure that your answers are age appropriate and relevant. So if my 4-year-old asks me a question, I don't want to pull out an encyclopedia and start telling him about everything about viruses. No, I want to make it as short and as age appropriate and as relevant to them. You want to stick to the facts. Make sure you're not purporting, and falsehoods. You want to stay with the things that are most factual. And I would point you to the CDC website if you're looking for stuff for coronavirus. You want to ask them about their specific fears and to reassure them. You want to remind them of what they can control. So for kids, you remind them that we can keep ourselves healthy by just washing your hands, staying away from other people, keeping the social distancing. And you want to also, when you're you want to remind them that children don't seem to be affected so much by the coronavirus. For your older kids, you want to ask them to kind of help them realize how likely is their worst fear going to actually happen, and that can kind of help perform a mindset for them. You want to model a calming presence. Turn off the news if you have to, and you also want to tell them about how you cope with things. Sometimes that is very helpful. You want to encourage them on focus on helping others. Once we are focusing on other people, it's a lot easier to stay positive. And you want to keep checking in on them. The next 3 slides, we're just going to kind of brush through because you can always come back to these slides for your age-appropriate child. For the toddler and preschool, I'll pause a little bit. Again, you want to use terms that are appropriate for their age and shield them as much from media as possible. For the school-age children, they are very motivated by rewards and by pleasing the parents, and so praise them frequently. Use positive reinforcement to help you, and extra hugs are always important. Reassure them that you are doing everything you can to stay safe. The younger kids they're most concerned about their parents being safe. And then for your teenager, you want to avoid lecturing them, and you want to keep as much routine as possible for every age group. But you also want to, for the teens especially, you want to watch out for risky behaviors, which can come out when they're concerned. The next slide. So we talked a lot about what do's and how's of talking to your children. These are some of the don'ts. I don't like to focus on the negative, but these are important. So for adults, you don't want to necessarily talk about adult coronavirus issues in front of your kids. You try to turn off the TV so that they don't have as much of the visual and auditory stimulation. This is one thing that some people they go overboard with cleaning. And so sometimes this actually increases the general anxiety of everyone. So just make sure you keep things clean and disinfected, but don't over clean. And then you don't necessarily want to brush away their fears. For example, if somebody says that your child says, "I'm fearful," well, what is there to be afraid of? Everything is just going to be fine. Well, that doesn't quite validate their fears. Instead, what you might want to see is say, I see that you are worried. Can you tell me more about what worries you and what we can talk about? And then, yes, the news makes it seem very scary. We can keep doing what we can, and things will eventually calm again. You don't want to blindly follow the media and their hysteria. You don't want to discipline with physical punishment. During these times of stress, it's a lot easier to go overboard. So try not to do any kind of physical punishment at all. And lastly, and sometimes parents do this, but they need somebody to talk to themselves, and they use their kids. And so the kids are not necessarily meant to be your counselor. If you need some help, get some help from another trusted adult, somebody you can bounce your ideas and fears off of, or get an actual counselor. Don't talk to your kids about what you need. Next slide. When to seek professional help. So you want to get help from a professional if you see that fear and anxiety has affected your normal functioning. If you have sleep or appetite dysfunction, if you have pervasive, meaning that it keeps coming back, thoughts of self-harm or hopelessness, or if you have somebody who starts to not be interested in doing anything fun anymore, anhedonia, those are times you specifically want to get extra help. You can go to the National Suicide Hotline if they have fear, thoughts of hurting themselves. If it's just other things that are general, you can go to your primary care provider. Or if they're starting to hurt themselves, you can go to the local emergency department or your local county mental health. And if it's non-life-threatening issues, but just trying to overcome fear itself, you can always go to your pastor or other, elder of the church, and they can help point you to the source. Next slide, please. Because the Bible is the answer, has an answer for every single problem. And in Philippians 4:6-7 in the NKJV, or the New King James Version specifically, it says, "Be anxious for nothing, but in everything by prayer and supplication with thanksgiving, let your requests be made known to God, and the peace of God, which surpasses all understanding, will guard your hearts and minds through Christ Jesus." I hope that helps you talk to your kids this week about what's going on and point them to the Bible.
Amen. Thank you, Doctor.